afternoon, and welcome to Orange County Mayor Jerry Deming's Economic Recovery Task Force meeting. We appreciate those of you who are here with us in person today, and for those of you who are joining us via WebEx. According to the Florida rules, we have to have a quorum in person, so we really appreciate you coming out here today. We have quite an agenda this afternoon, and we appreciate the time that you have put for this task force. We have a new co-chair today, which is Cassandra Mate. She is replacing Georgia Gell. She is the CEO from Visit Orlando, and we welcome her not only to Orange County, but also to the task force. And with us also we have Tim Giuliani, the CEO of Orlando Economic Partnership, who is also the other co-chair. And without further ado, I am going to go ahead and turn things over to the co-chairs. And once again, thank you for being here. I forgot to introduce myself. I'm Roseanne Harrington, Mayor Deming's Chief of Staff.
Thank you, Roseanne. Welcome, everybody. My name is Tim Giuliani. I have the honor of serving at the Mayor's request here as co-chair. I want to welcome all of you. Thank you for gathering online and in person as we deal with the latest news and reality stemming from the pandemic. So today, on behalf of Cassandra and myself, welcome. We call the meeting to order. And before we get started, even with roll, we want to turn things over and invite and introduce Mayor Jerry Demings to give opening remarks. Mayor?
All right. Thank you, Tim. Thank you to all of you for being here this afternoon as well. What I wanted to do was to call you, the thought leaders of our business community, together once again to have a conversation, a dialogue about the current state of affairs here within Orange County, so that as we move forward, the number one goal that we have is to keep our businesses open and commerce going. But in order for us to make decisions, it is going to require you to be updated on all of the current data. And so as I think about where we are today, we are under a state of emergency once again. As you all know, last week I signed an executive order under my authority as the Orange County Mayor, and pursuant to county charter, during matters where we are under a state of emergency, the Orange County Mayor becomes essentially the emergency manager for the entire county, inclusive of the municipalities. And so I did not make that decision lightly. I made that decision based upon an abundance of advice that I had received from our healthcare experts about what they were seeing within their respective systems. I want to talk a little bit anecdotally about what really also urged me to take action in a timely manner. And sadly, I have to report that we now have some 165,000+ cases of the novel coronavirus within our community over time, and approximately 1,400 individuals have died. But more importantly, this is a human experience, and members of my Orange County staff, my Orange County family, have been significantly impacted most recently. Last week, we funeralized one of our 40-year-old Orange County correctional officers. She was 40 years old and unfortunately contracted the virus, and within a week she passed. But not only her, but several of my other Orange County employees are currently in critical care units. I had the opportunity this morning to have a conversation with one of my Orange County female correctional staff members who, as a result of the virus, finds herself in a rehab unit after spending several weeks in a critical care unit at one of our local hospitals. Unfortunately, she has encountered significant damage, if you will, as a result of contracting the virus. But her brother, one of my high school classmates, passed last week as a result of the virus as well. And so, and within Orange County government, we find ourselves where we have the highest number currently since we started in March of 2020 with a focus on responding to the coronavirus. We have the highest number of county employees that are currently out with the virus. And that just gives us a snapshot of what's happening within our Orange County family, but also within the community. You're going to hear today from some of our subject matter experts who are going to give you the numbers, the data. We had a nurses organization cancel a convention that was due to take place this week. It canceled because of the current projections regarding the rate of transmission within Orange County. We obviously are in the high risk category at this point. The entire state of Florida essentially is in the high risk category at this point. And because of the media covering the fact that we were in the high risk category, there's this significant concern about what are we doing here in order to adjust to the current environment that we live in. I did not believe the appropriate response was to do nothing, because if we had done nothing, then that would have communicated something around the nation and perhaps around the globe of what kind of community that we live in. So we are making some adjustment. We have been a model for other communities and quite frankly for the nation on how to reopen business safely and to keep our businesses open. But we took action early on because of those of you from our business community here early on during the battle against COVID. We made some decisions here that allowed us over time to reduce the spread of the virus within our community to very, very low levels because we did all of the things right around the country. We were one of the first communities to get back open. And in order to keep our businesses open, we're going to have to make some adjustments. So today we want to have the dialogue with you. The positive side of it is while things have gotten bad, they can get better. They will get better. They will get better because of the collective efforts here in this room. We have demonstrated that when we come together as a community and we put our best and brightest minds together to address a crisis, we always come out of it better than when we went into it. I believe that given the current input and advice from our health care experts and researchers, they've said to us there are two things that we can do proactively to reduce the numbers. That is, number one, wear facial coverings. Number two, increase the rate of vaccinations within our community. And we have endeavored to do that, and the numbers have improved in terms of the number of individuals who are now getting vaccinated within our community. The clarion call to our business leaders has been heard, and we are seeing adjustments being made across the county through all sectors making adjustments now. And so let me just say thank you to our community for hearing the cry for us to do better, to put the life, health, and well-being of our residents first in this community, above perhaps even making profits. We have, as a community, I believe that the character of our community is being defined now by the actions that we will collectively take. So as the mayor of Orange County, let me just say thank you to this body for being here today, and I'm going to turn it back over to our chair and co-chair at this point to walk us through the remainder of the meeting.
Thank you, Mayor. And again, my name is Cassandra Mate, President and CEO of Visit Orlando. It's my honor to serve in this capacity, and it is very true. We are better together so we can get out of this surge very quickly and resume to normal business. As you have seen or heard, the travel sector, we have seen numbers surpass as far as visitation over 2019 numbers, so we're very eager to move forward together. It's my role to take a roll call of the task force members. If you are participating virtually, please remember to unmute your phone and speaker on your computer. Also, if you are representing a task force member, please announce your name and title for the record. So now we'll start taking roll call. Jesse Martinez.
Here.
Inez Long. Pamela Neighbors.
I'm here.
Evelyn Cardenas.
Present.
Doug Taylor.
Present.
Alan Johnson.
Present.
Dan Ward.
Present, and Casey Escobar, Vice President, on his behalf.
I'm sorry, I did not hear that.
It's Casey Escobar, Vice President, here on his behalf.
Thank you. Dave George. Larry Rodriguez.
My name's Eddie Santos. I'm representing Larry Rodriguez.
Kathy Ramsberger.
Present.
Raul Pino.
Present.
Carrie Burns.
Present.
Wendy Brandon. Steve Garrity.
Present.
Brian Combs. John Henry.
Present.
Michael Thomas. Johnny Rivers. John Newstreet.
Here.
Brandon Matuka.
Present.
Mary Chow. Mike Vanden Abel.
Present.
Jerry Ross.
Julie Matthews with the National Entrepreneur Center, filling in for Jerry Ross.
Wayne Rich.
Present.
Barbara Jenkins. George Rawls.
Present.
Cesar Lopez.
Present.
Phil Brown. Alex Martins. Douglas Lavramos.
Present.
Augusta Sanbria.
Present.
Pastor Roderick Zach.
Present.
Dan Giordano.
Present.
Brad Gilmore.
Present.
Tricia Johnson. Stephen Jameson.
Present.
Conran Santiago.
Here.
Deborah Linden. Frank Greco.
Present.
Sandy Hostetter. Yes. She is present. Dr. Wong.
Present.
Chuck Whittle. Present. Chris Earl.
Present.
Rich Costales.
Jeff Polk on behalf of Rich for Universal Orlando.
Harold Mills.
Present.
Monisha Brown. Mary Beth Bizinier. Todd Souders. Dan Wilcox.
Okay. All right, thank you. We're now going to move to public comment, and one last check with the staff, but I don't believe we have any public comment at this time. No public comment at this time. Thank you. We'll move next into the health update. So first, we're going to hear from Dr. Pino with the Florida Department of Health in Orange County. Dr. Pino will be followed by Dr. Shu with Advent Health. Then we'll hear from Dr. Rawls at Orlando Health. So at this time, Dr. Pino, you're recognized.
Good afternoon, everyone. Good to see you all. Sorry of the circumstances. The pandemic, as has been said,
Dr. Pino,
Dr. Pino,
you're going to have to pull that mic closer or get closer to it. There we go.
better now?
Yes.
So the pandemic has been said is in a new phase, and mostly due to the Delta variant. And the Delta variant has a few things that are quite dramatic for infectiousness. Is first the infectious the period from when the person gets infected to when they develop the disease seems to be shorter than with the other variants. So that indicates a level of aggressiveness. It also, the viral load, what a person sheds when they sneeze or talk or cough, with this one is 1,000 times more than any other prior variant. And the other thing that the variant is also doing is that vaccinated people are getting some infections. Now, just to put that out there, the vaccines continue to be effective for what they say they will be effective for. What the vaccines are effective for is to decrease the chances that you will get seriously ill and have to go into the hospital, that was always said, and also decrease death. And that continues to happen on significant numbers that are going to illustrate to you. But last week was our highest week ever in number of new cases in this pandemic, with 7,544 cases just last week alone. Now, when you translate that into how many cases we have per 100,000 individuals, and not to be alarmist, but in epidemiology, what we know is just a tip of the iceberg. We don't know every single case. We just know the cases that are coming to be tested, and we get the results. So it's safe to assume that it's also a number of cases that we don't know about it, because either they haven't been tested or because they haven't been experiencing any symptoms, and those are asymptomatic individuals. So it's also believed now, and this didn't happen with the other variants, is that vaccinated people who are asymptomatic can transmit the disease as well, even when they may not be experiencing very, feeling ill. Just to give you an idea, per 100,000, the lowest that we ever got was 6 weeks ago. And we were 6 weeks ago on only 52 cases per 100,000 people. Today, yesterday, we were at 511 cases per 100,000 people. So there has been a significant increase. The total number of cases yesterday was 924. Now, Sundays are not a good day to measure much of the pandemic data, because many places are closed, and it takes a lot for someone on Sunday to go and get tested. They have to really be feeling ill or considering themselves to have been exposed. So that elevates a little bit always the positivity rate for Sundays. But the positivity rate yesterday was of 21.34%. That's the highest we have in this year, in the entire year. And our positivity rate, rolling rate for 14-day average is now at 17.9%. And that one 6 weeks ago was also in 3%, 2%, or always below 5%. With regard to the number of deaths, we have seen a significant decrease in the number of deaths that we are experiencing. And that's in part because of the work that the health department and our partners did at the beginning of the pandemic with the effort of vaccinating people who were 65 years and older first and intensively, and also the work that has been done in long-term care facilities, which is always a concern, especially in our state where we have so many residents that are in the older segment of the spectrum. But just to give you an idea, our highest number of deaths was in January of this year, and that was 229 deaths that month. The one before that was high, or the closest, was July 2020 with 227. In February, we decreased to 112. In March, we did a big jump down to 59 cases, death. April 58, May 57, June 31, and last month 32. So last month, July, was the first month that we have an increase of death since we start vaccinating after the 6 weeks of the first doses that we gave. And we use that 6 weeks as data point because that's the first day that we calculated that someone in our community had full immunity for the vaccine. So bear with me on that one. We also did a complete analysis of everyone has been sick, hospitalized, or died since that 6 weeks from the first vaccines that we gave. And more than 95% of all hospitalizations and more than 95% of all death and more than 95% of all new cases were among unvaccinated people since February of this year, which indicates the urgent need to get vaccinated. And that number of deaths for last month will increase a little bit as some of the deaths go through the review. Now, I want to alert, and probably the hospital will talk about this a little bit, is that we have not seen the death that correlate to the current spike that we are experiencing. So this death for this current spike, we are going to experience in those maybe the week after next. We may see an increase in the number of deaths for the first time. We also have seen an increase in the number of outbreaks that we are following around the county, and an increase in the number of children that are getting affected by the pandemic at this point. With that, let me give you some of the numbers in immunizations that you would like to have for your information. So the county has totally administered 1.4 million vaccine doses to residents and non-residents. That's 1.4. And for our residents is 1,328,274,000. For percentages, the number of residents with one dose or more that are eligible, and I made that clarification, this only takes into consideration people who are 12 and older. It is 62.9% of our population has received at least one dose. And this is an interesting number. 53.8% of eligible people in our community are fully vaccinated. Another thing that is interesting too is that we have seen an recent increase in the number of people 12 to 17 that are getting vaccinated. And that is about 46% of those people in that age group. And that's an important age group to contain the pandemic. Because something that I didn't mention to you is that most of our cases are between 55 and 44 years of age. And we have seen a decrease on the median age of the people who are dying as well. So there are a few things that are indicating that we are going in the wrong direction at this point, and we have to take additional steps to contain this pandemic. And our area has a challenge, and it's the challenge that even what we do may not be enough, in the sense that we have so many visitors from so many places that we as a region may have to take additional steps to protect ourselves and the people who are coming as well. With that, any additional question or any clarifications? I'm more than willing to provide.
Yes. Any questions for Dr. Pino? Harold?
Dr. Pino, since we're now past the stage of sort of mass vaccinations and we're at the area where we kind of need to get to, smaller groups and conversations, do you happen to have the demographic breakdown for our community? For the last number I heard among African Americans is we were somewhere between 25 and 30%, as an example.
I don't have it right here with me, but we can provide it. We do have the demographics. But with the demographics, I have to alert that at the beginning of the data entry of the pandemic, people were not so reliable in the way that they entered that data specifically for demographics. Because sometimes they were entered based on appearance and how people look, and not asking the question, who are you, what race are you? And that creates some disparities there. But, yes,
but just as we think about strategies, we might want to think about narrow.
Oh yeah,
focus.
absolutely.
Okay.
Any other questions? Okay. Thank you, Dr. Pino. At this time, virtually, we have Dr. Shu from Advent Health.
Wanted to give you an update from Advent Health. Currently, our census is at an all-time high. Many of you are aware that we are in what we call black status, which is really the most critical status, where all elective surgeries have been put on hold for now, so that staff members, so we can get additional space and deploy staff members to take care of patients with COVID. Our current census stands at 711. That is for all our 8 Central Florida Division South regions. So it's more than specifically Orange County, but it does reflect a census that we have not seen. So we're about 135% of where our January peak was. So 35% additional cases so far. And unfortunately, we're continuing to see that census grow. We have not yet seen any indication that there's a peak. Approximately 40% of all our inpatient admissions now to our hospitals are COVID related. About 30% of all our ICU admissions are admitted due to COVID, and we have 125 patients who are currently on ventilators. We have done sequencing of a sample of our inpatient and ICU cases, and the vast majority of those cases are consistent with the Delta variant. In the community, we have seen Centricare, our percent positive, as has been at the highest level it's been from a percent positive. So we are over 25% testing positive for COVID. And as mentioned, we just do not see any immediate relief. All the models that we have looked at, which includes the CDC consolidated models, as well as the University of Washington, what they call the IHME model, both of them have projected the number of cases, or number of hospitalized patients, to continue to increase for at least another couple of weeks. So we are adjusting our planning to reflect that. The good news from a Advent Health standpoint is that we still have enough supplies. We have ventilators. We did order more. We have enough PPE. We have enough medications. We did have to restrict our visitation further because of the issues related to staff and patient safety. And we are continually focused on redeploying our staff to accommodate the increasing number of COVID patients. As Dr. Pino had mentioned, the vast majority of our hospitalized patients the vast majority of our COVID patients are unvaccinated. We are looking at the trends to see if there is an increase in percentage that are fully vaccinated, but I don't have all that data right now. we do see a trend toward increasing numbers of death, but that is likely due just to the increasing numbers of admissions. And so I don't have all the data to provide for that, but certainly later I can provide more specific data on rates at this point. That is my report. I'll turn it back over to Tim. Thank you.
Okay. Thank you, Dr. Hsu. Any questions on his presentation? Okay.
Tim.
Thank you, Dr. Hsu. I'd like to turn it over to Dr. George Rawls for an update from Orlando Health.
Thank you, Tim. George Rawls here, Orlando Health, Chief Medical Officer. We're seeing significantly higher inpatient numbers that's been reported. We're currently as a system at the all-time high that we've had. We're over 550 patients across our system today. The ICU percentage is lower than what we had seen in the past. Probably about 15 to 18% of those patients are in the ICU. But of the ones in the ICU, a significant proportion are on ventilators. And the patient population that we're seeing come in a little younger, still, in that sort of middle age range in general. So you definitely see that protective effect that the vaccine rollout had in that much more vulnerable older group. But they're a little younger, also a little sicker, higher percentage of pregnant patients than we had seen in the past. A lot of COVID-related illness, COVID-like illness with positive testing coming through our EDs across the entire system. So our internal percent positivity rate is in double digits, just like it was at our worst times in the past. We've made some adjustments to our visitation policies in response to what we're seeing in the community and what we're seeing in the hospitals. So we are limited across our entire system. In some very high risk areas, no visitation at all. In other areas, very limited visitation. Being very aggressive on our vaccine communication and vaccine programming with our team members, also making vaccine available to anybody we see in our ED. If they're there for any other reason, we tell them before they go, hey, we can get you a vaccine before you go. So we've had some success pushing vaccine out that way. And also now vaccinating any unvaccinated inpatients around the time that they're going to be discharged. So looking for every opportunity to get the vaccine out there. Because as has been mentioned, that really is the key to moving forward. Testing, equipment, supplies, PPE, all that still looks very good. Bed capacity has been tight. As Dr. Hsu mentioned, it's not just COVID patients. We have a lot of high acuity admissions coming in. We are managing in terms of space and capacity, but it certainly is requiring some creative decision making. And the majority of the patients in our hospital right now don't have COVID, and they're all still quite sick. And that's also been somewhat complicated by some recent trends in the healthcare sort of staffing landscape. You might have heard some of that. So working through those issues, but certainly, clearly, this is the most active COVID scenario that we've seen since the beginning of this pandemic.
Thank
Happy
you.
to answer whatever questions you have.
Sure. Thank you, Dr. Rawls. I think we do have one question that I see from Dr. Barbara Jenkins. You're recognized.
Thank you, Tim. To either Dr. Pino, Dr. Hsu,
I'm sorry, Dr. Jenkins, we can't hear you.
I'm getting like an echo. Can you hear me?
We can hear you just fine.
Okay. So for Dr. Pino, Dr. Hsu, or Dr. Rawls, I'm wondering if you can give us any more specific information around pediatric hospitalization, positivity rates, any updated information, particularly for the 12 and under range.
I could have more specific information for 12 under, but with regard to yesterday, just to give you an idea, we have 37 cases between 0 and 4 years old. We have 113 cases between 5 and 14 years old. And we have 193 cases between 15 to 24. And I just select 24 because that's about college age. And those are the important areas that we have to address. With regard to new cases rate per age, the frequency for yesterday, and this is probably 5 to 10 years old, so the highest increase is in between 15 to 19 years old, followed by 5 to 10 years old. That's where we have seen the highest increases on age groups. I don't have the information with regard to pediatric hospitalizations because we currently don't have access to that data, although working on that. But communications with numerous children's hospital on Friday, they have 4 children hospitalized for COVID-19 related issues.
Okay. Thank you, Dr. Pino. Dr. Hsu?
Thank you, Dr. Jenkins. Right now, we are still working on hospitalization trends specifically for pediatrics. I can say that we currently, as of last count, have 20 patients in the hospital between 0 and 18 years of age. That appears to be higher than where we had been in weeks past, and that is all I can say. We are continuing to work on these data, and we'll be fine-tuning that.
Okay, thank you. Dr. Rawls?
Thank you. Yeah, we haven't seen anything that appears to be a drastically different scenario for our pediatric inpatient population. We do have some cases in our children's hospital, but that has not really been our pressure point. In the scenario where we have had pediatric patients in the hospital, especially in the very young age groups, a lot of them are related to exposures around the time of birth, pregnant mothers. So most of those children, nodes of babies, have done perfectly fine. Or pediatric patients that have a lot of underlying medical issues. But as a sort of a specific population of patients, that we haven't seen anything that really has concerned us in terms of a pediatric inpatient population.
Thank you.
Thank you. Any other questions regarding the health update?
One question for Dr. Rawls from Orlando Health. Dr. Rawls, you indicated for your positivity rate that it was double digits. Can you say within the last week to 2 weeks what the positivity rate is for Orlando Health?
About 25% right now for our internal testing. There are some places where we've actually seen that go up as high as 30% for a lot of our ED patients that are coming in with COVID-related symptoms. So that's as high as we've ever seen.
Okay. Well, I want to, on behalf of all of us here, thank the three of you for providing the update and then for all of the work that your teams continue to do to keep our community safe and in some cases recovering. So thank you for your time today, certainly. I'll turn it now over to Cassandra.
Yeah, so as part of our health update, we'll now hear from Ed Torres, Director of Orange County Utilities Department, for an update. As you may know, Orange County Utilities is part of the CDC's National Wastewater Surveillance System. Thank you, Ed, and you are recognized.
Thank you, and good afternoon, everyone. So again, as was mentioned a moment ago, Orange County Utilities have been participating in the National Wastewater Surveillance System, where we measure SARS-CoV-2 RNA in the wastewater. This is being monitored in wastewater treatment facilities throughout the United States. We in Orange County Utilities started monitoring since May of this year. And what we're seeing there, those concentrations of RNA reflect both symptomatic and asymptomatic infections. These are fragments of the virus that are non-contagious, non-viable, but really they provide us an advanced warning of what's to come in terms of clinical cases. So it gives us between 4 and 10 days advance notice of what's to come. And I have seen this is being used around the world as a very effective tool. And I have personally have been working on this almost since the beginning of the pandemic. The pandemic in the U.S. started in March of 2020. I started sampling in other utilities since April of 2020. And again, that gives us a really good indication of what's happening 4 or 10 days before. Since the numbers that we presented last Wednesday, which had been had increased substantially, what we had seen since May is that we have seen in our 3 service areas that are serving around 870,000 people in Orange County, we had seen concentrations in the range of around 200,000 gene copies of the virus per liter of wastewater. And they were remaining, there's some fluctuations there, but they were remaining uniform during that time. The last 3 weeks, we saw a drastic increase. And again, the numbers that we reported Wednesday, and I'm going to start with the northwest service area of Orange County. I told you we were around 200,000 pretty steadily since May. That jumped to 1.4 million gene copies of the virus per liter, as we reported last Wednesday during the mayor's press conference. And as of last Friday and Saturday results, in that northwest service area, that concentration jumped to 1.984 million gene copies of the virus per liter. Again, almost 2 million when we were around 200,000 consistently throughout since May. In the east service area, and perhaps more concerning, is we were also in the 200,000 range or so. Last Wednesday, we reported 1.518 million gene copies of the virus per liter. And Saturday, we received the results from last Thursday at 3.034 million copies of the virus per liter. And besides the drastic increase that you can all appreciate, I want to put it in perspective for you. I told you that I've been doing this since the beginning of the pandemic, and the highest number that I have ever recorded during that time was during the first wave of the virus, and that was at 2.8 million gene copies of the virus per liter, and that was in June 30th of 2020, which immediately thereafter, again, 4 or so days after, we saw a drastic increase in hospitalizations at that time. Again, June 30th was the highest that I have recorded at 2.8 million. We're seeing 3 million this past Thursday. And again, that reflects an increase that we would see in clinical cases during this week that we're starting now. So that's all I have in terms of an update in that perspective. But this is, again, very reliable predictor, and we're really hoping that everyone takes this seriously, so we don't see these numbers continue to increase.
Thank you for that information. Does anyone have any questions for Mr. Torres?
Ed, I have a question. You said 3 areas. I got northwest and east. Did I miss one of them?
Yes, I failed to report the south service area, and that's at 1.2 million. And that has been the last week, the last numbers that we have has been around 1.2, 1.1 million.
Any other questions or clarifications? Thank you.
All right, thank you much.
We'll now move into best practices and talk about how we can work together as businesses and community-based leaders to increase vaccinations and masking to protect the health and safety of our fellow residents and visitors. I would actually like to call on Mr. Dylan Schott, Assistant City Attorney with the Orange County Attorney's Office, to review Orange County's recent emergency order. And now I'd like to recognize Mr. Schott.
Thank you. Dylan Schott, Assistant County Attorney with the Orange County Attorney's Office, is asked to present the executive order that the mayor signed on Wednesday. Wednesday, Executive Order 2021-24. It declares a state of local emergency in Orange County based on a lot of the information you heard from during the health update from Dr. Pinos, Hugh, and Rawls. The mayor made a decision to declare a state of local emergency in Orange County, which essentially allows the county to exercise certain emergency management powers that can include bypassing contracting formalities to get equipment or supplies and things like that. And then, of course, when we're in a state of local emergency, it also authorizes the mayor as the director of emergency management to issue additional orders if he believes they're necessary. It could be regulating businesses, gatherings, travel, those sorts of things that we all saw last year during the pandemic. The executive order itself doesn't actually touch on masking or vaccinations. Those are two issues that the county are working on administratively. So the first issue being masking. The county is requiring all Orange County employees inside Orange County facilities to wear face coverings while they're in the presence of other people. And then the second one is vaccinations. The mayor announced at the press conference that all Orange County employees, well, let me rephrase, non-union county employees would be required to be fully vaccinated, I believe, by the end of September, with a couple of limited exceptions. So if someone has a medical reason that they cannot be vaccinated, or if someone has a sincerely held religious belief, then the county will make reasonable accommodations for those people. And I think the intent behind this was to take a leadership role and encourage Orange County's businesses to do what they can and look into what they can do in terms of masking and vaccinations.
Thank you, Dylan, for that review. Do you have any questions for Mr. Scott? Okay, now I would like to call upon Sandy Hostetter, Central Florida Regional President with Truist, to share some of the best practice with our members.
I just want to make sure everybody can hear me. Okay, good. No, I just wanted to make a quick comment. I haven't even had a chance to tell Mayor Demings this, but on Wednesday when the CDC asked for everyone to wear masks, and I know Mayor Demings made a shout out for business leaders to do the same. Truist, we follow whatever the CDC recommends, and so that evening, fortunately, we went to full mask, whether you've been vaccinated or not, in our offices. The next morning, I was supposed to have our first in-person meeting with my entire team and our partners, which included about 60 people. Because of the mask mandate and the fact that some of our teammates were going to be on WebEx, I had to recuse myself and do the WebEx from my office by myself because I wasn't allowed to be around one other teammate without my mask on, and I was afraid people wouldn't be able to hear me on WebEx or understand me as clearly with my mask on. So fortunately, I was not with anybody. Everybody in our offices had masks on. 2 days later, I was diagnosed with COVID. So I, really, really thankful that I wasn't around anybody. I wanted to just let everyone know our company went to full mask. If you're on any Truist business, inside or outside of the office, and if you're with one other person. So I know Mayor Demings was looking for companies that had changed their procedures, but we changed ours the minute the CDC did, and it paid big dividends for my team.
Sandy, just to confirm, and you have COVID, but you were also vaccinated.
Yes, I was vaccinated. I learned that night. You know, I'd gone to a wedding, and we were seated with two people that were unvaccinated and not wearing masks. And so far, 6 out of 9 of the people at my table have been diagnosed with COVID, and we were all vaccinated, other than the guests that were not vaccinated. That you know, there's no way to tell 100% how you got it, but
thank you for sharing.
It's just, yeah.
Thank you for sharing. Next, I'd like to call on Jesse Martinez, the General Manager of the All-Fund End, to share your best practices.
Thank you, Cassandra. First and foremost, I'd like to start by saying that when we talk about best practices within the hotel industry, we haven't ever stopped. From a health and safety protocol standpoint, we've continued to do what we've done even pre-COVID. So nothing had lessened from that standpoint. The one thing that had, obviously, was the removal of the face coverings for those who were non-vaccinated, that were vaccinated. And then, of course, our guests just did what they want, let's put it that way. What I'm happy to announce is that many of my colleagues within the industry here in Central Florida, as of the CDC recommendation, and of course the plea from Mayor Demings, was to get our associates back wearing face masks, either vaccinated or non-vaccinated. And I can say that many of our large hotels have done that, and many others in the community. So happy to announce that. When you talk about best practices, what we focused on at the All-Fund, and I've talked to other GMs, is really about more of educating now. I think we're at the point where we need to educate those non-vaccinated employees to get vaccinated, and that's what we've done. On top of, there's incentives out there that we've all done to get our associates actually vaccinated. We're doing $100 if you did it. We did 4 hours of work time prior to that, but we upped the ante a little bit to help encourage that. But most of it's education by we, and I know a couple other hotels have actually gathered our own task force within our own hotels to really sit down together as leaders and figure out best practices within our hotels to figure out how we can educate our employees. And so that's what we've been really focusing on: additional signage, training, educational signage in the back heart of house to really promote being vaccinated. And as to why, today I sent out 2 articles that I had read just over the weekend to all employees, just again educating and focusing on getting them vaccinated. So when you talk about best practices, I think we do a great job still from a cleanliness standpoint. And now that we're back to wearing face masks, hopefully for not very long, but be back to doing that it's more about the education. I think, of course, this is why we're formed here also, to start doing that as a team. But from our standpoint, that's what we've been doing.
Thank you. Now we'd like to open it up to the members to share your best practices or ideas.
Maybe we can start with Phil Brown at the airport. I know you're being aggressive about vaccinations and masks with so many people coming through the airport.
Well, we've never stopped having masks. That's a federal mandate. We did at one point for those vaccinated in meetings, we didn't have a lot of that, or we permitted that, but that's all changed. Everybody is back to masks throughout the airport. The challenge, of course, that we have is that enforcement of that with the passengers in the terminal can be challenging sometimes. So the other thing that we're actively pursuing is medical provider for vaccination. The state withdrew their vaccination program. I'm working with Dr. Pino to provide vaccines, and I've gotten some financial information from providers, and the level of cost is is pretty significant. So I was hoping to be able to do this on my own signature, but I'm not going to be able to do it based on the preliminaries I've had. So we're going to likely have to bring that to the board, or either do an emergency basis. I've got to work through the procurement process with our attorneys and our procurement department, and obviously with concurrence of our chairman. But right now, we're trying to stand up a vaccination site in the airport for both employees and travelers alike. So that's the extent of what we've been able to do up to this point.
Evelyn with Central Florida Auto Dealers Association. I have a question. As far as best practices or ideas, I guess, to kind of get ahead of this, our more recent challenges have been the medical exemptions and the religious exemptions. And so on those two areas, I'm wondering if we could do maybe a better job of, or maybe somebody's already doing it, of how do you help somebody that's got that medical trepidation that if I get the vaccine, it's going to make something worse, or it's not going to help me because I've got this concern that it's greater. So this health concern is greater than what I understand the vaccine is going to offer me. So maybe an approach would be, look, if you've got this condition, these people with these conditions have been protected and have benefited from the vaccine. So, along the lines of education, we're telling them, look, it's okay if you have this condition, but, if we can't educate them, then we may not be able to get that vaccine rate up. And then on the religious exemption, is there a way to maybe find best practices for somebody that because of their beliefs, they absolutely can't get the vaccine? So maybe, okay, can you do this for us to be part of your community and contribute to the community you live in?
I think, Dr. Pino, you might have the most experience handling these situations. Would you maybe share?
Yes. So with regard to the vaccine itself, it's a decision between the medical provider and the individual. And only the personal doctor who knows the medical history could really advise on those issues. But also, when weighing risk and benefit, and we all do that all the time. We may not know that we are doing, but our mind always balances risk and benefits when we are making decisions. National experts are saying that everyone who is unvaccinated will eventually get the Delta variant. It is that aggressive. And that scares me when I heard those comments from Dr. Fauci on the weekend, that is so aggressive that everyone who will remain unvaccinated will eventually get it. And on that risk and benefit, the issue is what is the risk of getting the vaccine and feeling a little bit lousy, which some people feel for 24 hours, or getting the virus unvaccinated, the same pre-existing conditions that you have concerns with regard to getting the vaccine, I will send you to the hospital if you have pre-existing conditions. And that's a decision that the individuals have to make. With regard to religion exceptions, that's a little bit tough to regulate in the sense that in reality there are not religions exceptions in the sense that no religion besides Jehovah's Witnesses technically opposed to being vaccinated. But it's the space for also that philosophical issue that some individuals may have with regard to vaccine, and we also have to respect that some individuals may believe that in their religion or their views, vaccinating is not appropriate for their belief system. But it is a complicated issue, and that's why in some instances making the space for those individuals to have a appropriate place to, disregard the vaccine. But again, it has to be in consultation with the personal provider. We don't advise anyone, and we don't do it either at our department, telling a person you can get vaccinated, you can not get vaccinated. It's a decision of the person. If the person has a medical condition, the provider have to certify that that person could get vaccinated.
What I would do is just add to what Dr. Pino has said in terms of best practices. What we are doing in Orange County for those employees who may have a particular exemption, we're going to require a regular testing that employee be tested at least on a weekly basis. In some companies, they're going to be testing the employees even more frequently than that, who have the responsibility as an employer to protect the other employees as well as the patrons of that particular business. So you're going to have to make some decisions with whether or not you will do testing. Later today, we will announce a second testing site within Orange County that we hope to provide the testing and the opportunity to get vaccinated. But there are a number of other community opportunities to get vaccinated and or get tested, whether you go to some of the freestanding emergency rooms or walk-in clinics throughout the county, or you go to retail pharmacies, the CVS, the Walgreens, etc. And then there are a number of other community-based organizations that are also offering opportunity to get vaccinated. And so we work with the Florida Department of Health in Orange County and Dr. Pino and his staff. There's a mobile vaccination trailer that moves throughout the community, and they're partnering with employers in different locations to offer these opportunities right at the employment site. So that is what I would share with you in terms of best practices, what you're going to see around, I think, not just our community, but all over the country. You're seeing different employers who are requiring non-vaccinated employees to be tested on a frequent basis.
I can talk a little bit about Disney World best practices. So approximately midweek last week, we made the decision that we would go back to mandating masks indoors for all cast members and guests. And shortly thereafter, we decided that we would go forward with mandatory vaccines for all United States cast members, and we would be giving our cast 60 days to get those vaccines. So although nothing about the last year and a half has been easy, I would say some of these decisions have been easier by us staying with our core values of safety first and wanting to ensure that both our cast and our guests stay as safe as possible. And so it's been very critical that we explain the why behind these decisions. And so I would say as part of our best practices, it's been a lot of communication with all of our cast and with our leaders so that they're armed with the understanding of why we've done what we've done and how we will help them. We're doing a lot of vaccine education to all of our audiences, some that perhaps have English as a second language in different communities within all of our operations so that they understand both accessibility to the vaccine and we're answering any of the questions that they may have. So I would say that we'll continue to use safety as our number one key and allow the cast to have as much access to both information and vaccines as we possibly can.
So this is Frank Eckel with Travel and Leisure. We represent approximately or operate approximately 240 resorts across the country. One of our largest resorts is here in Orange County at Bonnet Creek, which is over 1,200 units. we have mandated masks for all employees, regardless of their vaccination status, at all our resorts. In municipalities where it's required by law, in such places like Las Vegas, we are requiring that of our guests as well. And we are encouraging it of our guests elsewhere. All corporate staff here in Orlando are also required to wear masks regardless of their vaccination status, effective this Saturday.
Thanks, Frank. Dan?
Tim, I'm sorry, the Disney representative, I just have a question for her. And I admire, the step requiring vaccinations. It's a bold one. How did you weigh that in terms of the tight labor market and the impact that could potentially have in that context?
Certainly it was part of our conversations and will continue to be. Again, for us, we just had to continue on the path that we've been on since the very beginning of this in using safety first. And what we've decided to do is make sure, A, that we're explaining it, and we're also talking to all incoming labor markets that we're still trying to hire as to why we would want them to be in this environment. I truly believe, and we truly believe, that making this environment as safe as possible is going to give them greater job security and help our business overall and help all of us overall. So that's the approach that we've been having, and we will continue to do as much education as we possibly can.
Thank you very much. The more that follow suit, the better off it will be for everyone. It's a big help to all of us. Thank you.
Thank you. Any further examples or discussion?
Hi, my name is Eddie Santos. I'm the Director of Operations for Don Julio. Now, one of the, I guess one of the new measures we've taken, well, we're going to be taking this coming week. We're holding several general staff meetings within our 4 locations, not to mention our new location that'll open up on the 9th. And one of the major points of focus right now is we're not mandating that our staff gets vaccinated, but as the lady just mentioned, we are giving them as much information as possible as far as the Delta variant and the current status of Orange County, just to make sure that the staff takes this as not just, will I get a vaccine, but more a thing of like, maybe I just should, and with that, we've also created a second team to clean our locations. We were doing cleanings twice a week. We're now doing cleanings three times a week. And when I say cleanings, I'm referring to like deep sanitizing the location, which in turn, basically what it does is it makes all our staff aware of how serious this is, and it's kind of a way to get everybody on board with vaccinations. We haven't changed any procedures outside of the mask, which we middle of last week we went back to getting all our staff to wear face coverings again. Yeah, that's basically it.
So just a question for the group as you're thinking about possible best practices. Is anyone having conversations within your companies about incentivizing? I know we're having a discussion on rewarding those that are already vaccinated with an extra PTO day, or we're going to give a certain time frame for those that are willing to get vaccinated within the next 30 days. Is anybody having those type of conversations and thoughts?
A $200 incentive to employees who provide evidence that they have been fully vaccinated, and that information goes through our wellness program. $200 taken out of some of our ESSER dollars. In case you hadn't heard, the governor has essentially outlawed any mandatory masking of students at this point. So we are aggressively going after highly, strongly encouraging mask wearing on our properties, and also providing an incentive for employees to be vaccinated. And currently, we're around the 40% mark for employees that are fully vaccinated.
Another question regarding vaccination. At Tertiary Entertainment, one of the things that we started doing on Fridays, we reimposed for all of our employees the wearing of masks. This week, by the end of the week, we'll put the finishing touches on a likely mandatory vaccine policy. As a part of that policy, we're exploring the use of incentives for current employees, as we also look intently and likely will require any new employees to be vaccinated. So the incentive portion for us will be for existing employees, as we likely give up to 60 days for those employees to be vaccinated. Within a short window of time, probably 14 days, we'll provide that incentive. So we're trying to provide an incentive. It's going to be backed up by a mandate. And if we hire you new, then you've got to have a vaccine.
Harold?
So these are great ideas, and I would just only encourage us to remember that our community is in fact made up of a bunch of small communities. It's the communities within our businesses, it's communities within our churches, candidly, it's communities in where we donate and give money. So even as business leaders, as we think about our own employee bases, which are absolutely critical in those communities, even the places where we donate money, we should really try to use that influence to encourage the same type of behavior, as well as using our resources to get some of these organizations access to vaccines and testing as well, when they may not have as much liquid resources as we might as an organization.
Well, it's good to hear so many ideas, and I think if we recall back to the earlier phase of this pandemic when we were all gathered, really trying to learn about what this was about, it took proactive leadership, and the mayor certainly provided that. But if you remember, it was also a lot of private sector leaders that went out without any calls from government and took action on their own to cause our community to be safe. And even during that time, we had some support, at least from the state level, to try to protect the most vulnerable. And I think, what we've heard today, Dr. Jenkins' example, for instance, is we're not getting that same support to protect the most vulnerable from the state this time. And so pulling together this group to understand what is within our power, what can we do, and to hear so many private companies stepping forth with pretty aggressive mask requirements and also mandatory vaccinations or incentivized vaccinations. There are some of those tools in the toolbox that we all have in this new phase of the pandemic. And we can't sit here and rely upon some other level of government to come in and solve this problem. It's really the community that sits around this table that's really going to have the most impact on how we make it through this phase. And if you also remember, as we were sitting around talking about these issues, it wasn't but a couple months later when we were sitting around talking about the MLS coming to Orlando and the NBA creating a bubble here in Orlando and opening up tourism for the country to come back to Orlando. So just as fast as we were sitting here last time in the phase talking about these solutions, we did take action and we were proactive. And then that, in quick result, turned around and saw so many positives for our community. The Front Yard Festival at the Dr. Phillips Center is another example. So many great examples of how resilient our community was. But I think it's going to take an extra level of effort this time. This is a different phase. This is a different strand of the virus. And so we're going to have to do different things. And unfortunately, our mayor doesn't have all the tools he once had to help. So he needs all of us to contribute to creating a safe environment, which will allow us to stay open, which will allow us to continue making sure people have jobs as we get through this phase of the pandemic. So I think it's really important. It's great to hear so many comments and suggestions. And before we adjourn, we certainly want to turn it over to the mayor for any closing remarks you might have.
Thank you, Tim. Let me just say that, the takeaways this afternoon is that we can control to some extent, our own destiny by doing these simple things that we talked about this afternoon, increasing the level of public education about the need for the collective of our community to come together to protect all of us, and we can do that by wearing facial coverings and by increasing the rate of vaccination for most people within our community. So if we're consistent in the message, I believe that that will also preserve our opportunity to keep our commerce going. If nothing else, in order for people to feel confident and safe to come here to our community, we have to demonstrate that it is indeed a safe place to come. And so we cannot do that without all of your help in that process. So I'm going to say to all of you, thank you in advance for what you will do with the messaging, the public awareness campaigns, to put factual information out there and not the misinformation. We can dispel the misinformation with factual information and try. Despite our best efforts, there may be some who just will not do it. And but if we can move the needle to that 79 or 80%, we will be better off in the short term and the long term. And so the other thing that I will tell you is, let me just say thank you to Mayor Dyer and the City of Orlando, as well as Florida Citrus Sports for hosting this event here this afternoon. We appreciate the partnership with the City of Orlando and our entire community in this effort. And with that, I think I don't have anything else. Let me just say also thank you to my staff who had to work to make this a reality today. They didn't have a lot of runway in front of them in order to provide the landing space for all of us to come together. Orange TV is recording this so that others within our community can see the conversation that we had before. And finally, I would say to all of you, the goal is to keep our businesses open, but do so in a safe manner, in the safest manner possible. Thank you all very much.
Thank you.